Hello everyone, welcome to my channel. In this video I'm gonna cover on step 2 surgery dermatology question. If you would like to see more step 2 questions, please like and subscribe. A 52-year-old woman presents to his primary care physician for an annual wellness visit. During the skin examination, the physician notices a pigmented lesion over the patient's left shoulder. The patient says she became aware of it about a month ago after her spouse pointed it out, but she is unsure how long it has actually been present. The lesion does not itch, bleed, or cause pain. The patient has no significant past medical history and takes no prescription medications. She spends most of the year working as a sailing guide and rarely uses sunscreen. She has no family history of skin cancer. Her temperature is 36.8, blood pressure is 124 over 76, pulse is 72, and respiratory rate is 40 per minute. A photograph of the lesion is provided. Which of the following is the most likely diagnosis? So for this question, I would like to use the process of elimination, starting with A. Seborrheic keratosis. This is not similar to what we have here. So with A, we usually see benign pigmented lesions. They're usually not nodular and they're velvety and greasy. So they have a greasy surface. So we don't see something like this. And B, malignant melanoma. So with malignant melanoma, we usually use the ABCDE criteria. So asymmetry, border irregularity, and color variation, diameter of more than 6 millimeters, and E, evolving. So it changes in color, in size, and but here we are not seeing many of those criteria. But there are two types of melanoma. We have horizontally grown melanomas and we have vertically grown melanomas, and the ABCD criteria more so applies to the horizontally grown melanoma. And with vertically grown melanoma, which is more nodular, we necessarily don't see all of the ABCD criteria, and we rely heavily on basically the ugly duckling sign. So if patient has one lesion on their skin that's so different than the other lesions, that could be a sign of melanoma, especially if the patient is receiving a lot of sun exposure and they're not using sunscreen, which is the case with our patient. So I would say B could be the right answer, but let's look at the other answer choices. C, keratoacanthoma. So with keratoacanthoma, we see dome-shaped lesions with central keratinous plugs, and this is not what we are seeing here. So I'm not gonna go with C. D, Sherry hemangioma. So with this condition, we see red, bright red lesions on the skin, and they're flat, and it's a benign condition. And this is not what we are seeing here. The color in the patient's lesion is, I would say, dark red, and also it's not as flat. E, basal cell carcinoma. So basal cell carcinomas are usually masses that are fleshy and they have ulceration. And more specifically, I can't see the ulceration here. So I wouldn't go with E. F, angiosarcoma. Angiosarcoma, similar to D, is red, is bright red, and our condition is not bright red. And also, angiosarcoma is common in patients who have previously received radiation therapy, and we don't know that about our patient. So I'm not going to go with F either, and the correct answer choice is B, malignant melanoma. Thank you for watching. If you would like to see more of these videos, please like and subscribe.